I'm here with Dr. Linong Ji, Chair of the Stream on Global Challenges in Health. Dr. Ji, thank you very much for being with us.
Thank you for letting me here.
So let's just start with the big picture. What are some of the global factors that you can see contributing to an increase in people living with diabetes around the world?
There's now this epidemic of diabetes around the world, especially in the developing countries such as China and India. Now China and India contribute about 80% of the whole diabetes population around the world. If you look at how the diabetes population has increased so much in these developing countries, it's lifestyle changes. Unhealthy lifestyle is a great contributor to the current epidemic of diabetes in the developing countries.
Your stream is going to be looking at some of the ways that it's possible to tackle these global challenges. Give us some examples.
Yeah, true, diabetes is a global challenge. My stream tried to tackle this problem by several sessions. First, because there's a very interesting session on the famine and diabetes. So the session will examine whether the famine that lead to undernutrition during the early development of human beings contribute late diabetes risk. There's evidence that the famine, because of undernutrition, the uterus, the fetus will have undernutrition, and that will have impact on the later life. For example, they will have more chance of getting diabetes and cardiovascular disease. This will have a great implication on how we can avoid this problem by provide good nutrition to the gestational mother.
How important is the role of national governments in fighting diabetes, and also the role of international organizations like the WHO?
Yeah, international organization such as the WHO is a good organization that can engage the government in fighting diabetes, because the diabetes is not just a medical problem, it's a public health problem, it's even a social problem. So with the help from the government, we can not only prevent diabetes, but also improve the life of people with diabetes.
And how do we do that? How do we stay focused on that which is important? Of course, that being the lives of people who suffer with diabetes.
People with diabetes, for example, type 1 diabetes, they are still don't have a good care in especially developing countries. For example, in the 3C study in China, we found that rarely type 1 patients live with their disease for 30 years, where in Western countries, such as in Europe and the United States, many type 1 patients, they can live over 50 years or 75 years. So IDF has organized a 3C study by helping China to identify the defect in the health system for taking care of type 1 diabetes. And also in this stream, we have a tuning program that tune the well-developed countries with developing countries, so resource-limited countries, how they can help each other, especially the helping from developing countries build up their health system for diabetes care, and also for special problems such as diabetes food.
Dr. Ji, thank you so much for spending time with us
my
today.
pleasure.
Really appreciate it.
Okay.